Hi everyone, Dr. Lam here. Today I wanted to show you how to use Oxervate. It is the first and only FDA-approved medication for the treatment of neurotrophic keratitis. This is a condition where the cornea loses sensation and your brain isn't able to get the signals to help it process and produce the adequate amount of tears. So when the system is damaged and the nerves aren't working, it can cause persistent dryness and damage. So Oxervate is a recombinant human nerve growth factor that helps to regenerate these corneal nerves so it can heal, and it tells the brains how much tears to make. So now that we have that down in a nutshell, let's go ahead and talk about how to administer this medication. So first of all, if you're wearing contact lenses, you want to remove that, or maybe start first thing in the morning, no contact lenses in. But regardless, anytime you put a medication in, no contact lenses in. If you're using that medication and you have other medications or tears that you want to use, you want to make sure you wait at least 15 minutes between each medication. So whether it be Oxervate, another drug, artificial tear, you want to wait 15 minutes. The reason for this is that you don't want to wash out and flush out that medication, so we want it to work. Also, from my experience, some patients may experience some eye pain or more awareness and sensation, especially around the upper lid, perhaps after 1 week of use and on. Sometimes that sensation is very short-lived, sometimes it's a few weeks, sometimes it's for the entire duration. The thought is maybe that these corneal nerves are starting to wake up, they're sensing again, so you're just getting a lot more feedback to the system. The dosage for this medication is to put 1 drop in your eye every 2 waking hours for a total of 6 drops during the day. So 6 drops a day for 8 weeks. So I'm going to go ahead and show you step by step on how to administer the vials and how to use it so you have it down. So this is the setup that I like to do for the day if you're using Oxervate for both eyes. The vials are going to come cold, so you want to go ahead and put them in the refrigerator. And every morning, you're going to take each vial out of the fridge. So if you have 1 eye that you're treating, you're going to take out 1 vial. If you have 2 eyes, you're going to take out 2 vials. So this setup is for 2 eyes. You're going to see a vial adapter, and 6 syringes. Each time you do a dose, you're going to use 1, discard it. Use another, discard, and so forth. So I'm going to show you how to put all this together. Okay, so as I mentioned, you're going to take this vial out of the fridge, and this is what you're going to lay out. This is just going to be the first dose. What I like to do with clean hands, wash your hands, open the vial, and then you're going to open this vial adapter. This is what it looks like. It does have a little needle here that you're going to use to puncture this vial. What I like to do first is take alcohol swab out. Just go ahead and wipe that vial top. I'll just leave this here. You're going to let that dry. And then you are going to puncture it into the vial adapter without touching the inside. You're going to hear a pop. You're going to take it out. It's going to look like that. That's nice and set. Go ahead and take the alcohol, rub the top of this so it's nice and clean. Now leave that down. Now that's ready. You're going to use this for the rest of the day. So then we are going to take out our syringe here. And again, 1 syringe per eye. You're going to open up like this. Keep that part sterile. You're going to take it off. This is going to have a little grip here so you can grip there. You're going to push it into the vial and twist. Well, take some force there. And you're giving it a good twist so there's no more resistance. So that is the full unit. So when you're ready to go, this vial has enough medication for the full day. So what you're going to do is turn it upside down, and you're going to draw out 1 full syringe. It's already pre-drawn, so you're just going to pull it down. Now, if there are any air bubbles in there, you can pop it back up and try it again. So you're going to get 1 full draw like that. That's going to be enough. And then we're going to untwist this vial off. And now we have this drop that's ready to go. I do feel like this little plunger is a little delicate, so be careful. So let's say this is your eye, and now you're going to put 1 drop into your eye. That's it. Now you're going to discard this, all that, and you're going to save this for your next dose, and then you're going to get a new syringe that comes out. So I hope that was helpful on how to use Oxervate throughout the day, and you're going to continue this for the full 8-week course. Purely educational, not medical advice, but if you have any questions, comments, please drop it below. Happy to answer. Have a great day.